Some of our therapy options, and physicians often look to guidelines for treatment in a variety of cancers, not just CLL. But I think what we need to keep in mind is every person is an individual. And once you've made a decision to treat someone, whether as initial treatment or as subsequent treatment, you have to look at that individual and make a decision. So it's not a one-size-fits-all. So you have to take into consideration their age, their other medical conditions, if you're choosing a second or third line therapy, what they received previously, how they reacted to it, how beneficial was it, how did they tolerate it. And I think equally important is a goal of therapy for that patient. For some individuals, they don't want to lose their hair. Fortunately, that's generally not an issue with any of the therapies we use in CLL, even our chemotherapy drugs. Others like the idea of taking a pill. However, at present, with those oral therapies I mentioned, we use them indefinitely. I think that can change in the future. So some people don't like the idea of taking a daily medication indefinitely and would rather receive treatment in that 6 months, even though it's chemotherapy and even though it's intravenous. And then, of course, there's financial considerations. And I think that's a little more variable in the U.S., of course, because of our healthcare system, but it's still, I think, an important consideration. So, as I mentioned, it's not a one-size-fits-all, but you take all that into consideration, and then you have options about what might be appropriate to achieve your goal in that individual. I think that can be very different for somebody who's 80 years old versus somebody who's 60 years old. And remember, for CLL, the average age at diagnosis is in the early 70s. And most people don't need treatment right away, so the average person really doesn't come to treatment until they're in their mid-70s. And so we really need to respect the fact that there's other issues rather than what's the, quote, best therapy. It's not just one therapy that's best for everybody.